what we do whenever we have an alpaca born. And so we have these sheets that we've created. This is the birth checklist that we do for every single alpaca born on this farm. So it has the dam or the mom, which is Alexis. It has the sire or the dad, which is Picatinny. The date that it was bred. So she was actually bred twice. And the due date. So her due date was 5/22. She did not give birth until 6/16. Found her at 2:20 in the afternoon, and she's a female. Her birth weight was 12.6 pounds. Her birth temperature was 98.1, and you saw that we warmed her up until she was 99.4. We didn't do the respirations or the heart rate because everything was normal with her. She was sternal, meaning that she was upright, sitting more upright at 2:30 p.m. So 10 minutes after we found her, and she started to stand at 3:15 p.m. At 3:10, she did try to nurse, and she successfully nursed at 3:25. So we did not have to give an enema because she went poo-poo. We do put chlorhexidine solution where the umbilical cord came out, and we did that 3 times, which is how many you're supposed to do. We always check to make sure that they have teeth, that their ears are upright, that their eyes are bright, that they have 4 teats. So alpacas are supposed to have 4. Her genitalia is normal. If you remember last year, we have one that is a hermaphrodite, that her palate is normal, that she doesn't have like a cleft palate. What time the placenta passed, the placenta was normal, it wasn't torn. On the mama, we always strip the teats, meaning there's a wax plug that develops at the bottom of them, and we make sure that we pull off the wax. Mama's milk is in, and the mama, Alexis, is definitely attentive. We then give 3 medicines to the alpaca: CDT, which is tetanus, we give Bose, and we give vitamin A and D. And this is all just to give the baby the best start to their life. So we have done all of these. So we fill this out on every single alpaca. We monitor. And so if we were to have an alpaca mama that consistently had maybe the wrong number of teats, or had babies that had a bad palate, we would look at the mom or the dad, could trace it back. So keeping notes is really important. Without data, it's really hard to know exactly what's going on with the babies.